Hi, I'm Steph Bolton, and I'm one of the lecturers at Hartlepool College of FE on the health and social care courses. I also am the coordinator for apprenticeships within that school. Okay, and today I'm going to be talking to a couple of students, one an ex-student and one a current, who've undertaken apprenticeships within the health and social care sector, and they're just going to share some of their experiences with everybody who may be interested in this. So the first person I would like you to meet is Kelly. So Kelly, morning. Could you just tell us a little bit about yourself, what apprenticeship you did and when you started it, please?
Good morning, Steph. My name's Kelly Foster. I'm 42 years old. I'm currently a specialised therapy assistant working for North Tees and Hartlepool NHS Trust. The course I'm currently attending is the Level 3 Diploma in Lead Adult Healthcare Worker in the Integrated Health and Social Care sector. I applied for a position on the course in April 2019.
Great, Kelly, thank you. So, as you said, you're employed by the local hospital trust, yeah, and you told us there the different qualification you're doing within this apprenticeship, and the standard that you were following is the lead adult care worker. I just wanted to touch on a little bit about that apprenticeship. This is a new way of working, really. The integrated healthcare specialist role that North Tees and Hartlepool Borough Council are trying to develop to meet the increasing need and pressures on both the health services and social care services. And you were part of a pilot apprenticeship, really, to see how we could build this flexible workforce that could meet the needs of both sectors as they present themselves. So you've been a bit of a trailblazer in this area. So that's great that we've got you on board talking about this. So at the time, during your apprenticeship, is there anyone else from your employer on the course?
I have another 3 colleagues who attended the course in April, commenced the course in April with myself. At the time, I didn't know the other girls.
Oh, okay.
So when we were invited along to the open day with the college, I attended with my line manager, who was the one who did initially sent out an email just asking anyone to register their interest in the course. So we attended, and there was a few of us who registered their interest and attended the college and gathered all the information, what the course was going to entail, how long it would take, what sort of study time it would require. And then following on from that, I was lucky enough to be allocated a place and had sort of like an informal meeting with my manager to sign learning agreements and contracts. And then she informed me of the other girls who had obviously been allocated a place as well, which was lovely because we sort of formed a little bit of a friendship group prior to beginning the course.
Right.
So that's how it sort of came about.
That's great. So what was it then that inspired you to apply for it then? Obviously, you said you came to the open day, so you knew a lot about what was going involved in the apprenticeship before you even signed up for it, yeah? So what made you think, yeah, this is for me?
I think what inspired me was the fact that I could see within my working environment the changes that were happening, and this course sounded ideal for going forward for the skills I would need as a lead adult care worker. Obviously, I think getting more involved with the social care side of things as well. Our role in as a specialised therapy assistant was evolving, not just around the therapy. So it was really interesting to know that that course was going to be available and for the progression in my career path as well.
Excellent. So you talked about, you put your name forward, you expressed interest into the apprenticeship. Did you have to go through then a recruitment process? Was there an interview or
Yes,
something along those lines?
yes, there was a telephone interview from the college, and obviously more of an informal interview with my line manager as to why
Mm-hmm.
thought it would benefit me, and we wrote a little statement really regarding why we wanted to sort of show an interest, really.
Excellent. And that's good for other people who might want to do an apprenticeship to know that, there is still there is a recruitment process involved.
Yeah.
So, and would you say one of the things that helped you was attending maybe that open day and knowing a little about what was expected once you came on the apprenticeship?
Yeah, absolutely. I think it's not just about attending a course, it's having that passion and understanding that it is a big commitment, and that you are very lucky if you get a place, but you have to be willing to give up time and put a lot of effort in to gain the results as well. So
I think that's great advice, Kelly. That's really useful, I think, for people who are interested in apprenticeships. Yeah. So obviously then you got onto the course, as you said, onto the apprenticeship. Just tell me now a bit about the experience you've had during the apprenticeship. So like at the beginning, you've already mentioned you didn't know any of the other girls on the course, even the ones who were coming from the NHS setting, but you'd managed to sort of start a bit of a friendship group with them. Just talk me through how things developed on the course and to now, really.
Well, I think being an older person,
Not old.
getting back into education can be quite daunting.
Mhm.
And coming into a college building that you've never been into before. But I think, like you say, from coming into the open day, it gives you that sense of it's not that actually scary, not too scary doing it again and getting back into learning. All the staff and everyone is so welcoming, and that puts you at ease, really, I think, at the very beginning. Obviously, the girls from the social care side of things we didn't know, but I think there was 11 or 12 of us in total.
Yeah.
And it was so lovely to hear what jobs they did, where they worked, actually discovering that I'd probably spoken to some of them on the telephone because of the system we work in and passing over patients and things like that. So, and then moving forward, I think attending college on that every Tuesday, just getting to know each other, having lunch together, forming that bond that from your cohort, really, and obviously from yourself, the support you give, and Emma Campbell, both fantastic in gelling us as a group. And the whole experience, really, you've got Emma coming out to assess you within your workplace, and she doesn't put any pressure on you. She makes you feel so relaxed. She's there to observe you and put you at ease, really. And she's so professional throughout all of her visits. The whole experience, the learning, I have to mention the fact that the college, the system they use, the quals, I think is so easy to access and follow. For, like I say, someone getting back into learning, I found that excellent. And the facilities that the college offer, the learning course and the library where you can go and find references, research, books, information. The IT support is excellent. And even just like I say, the learning course where if you don't have a quiet space at home, you can go there and use the IT systems, and it gives you that space to learn away from the disruptions you may have at home.
So that sounds quite a positive experience you've had there then, Kelly. So you mentioned there about Emma coming out to assess you in the workplace. So that's showing, that you do have to have the practical skills as well.
Yeah.
how did you manage to sort of balance everything? Because obviously you were doing theory work, so you were coming into college and doing written work and having to produce assignments, and then you had practical skills, and then you've got your job, and then you've got your family. How did you manage to do all of that?
I think it's just about finding a good work-life balance, and I found keeping a diary very helpful. Also, like I say, when I did get half an hour, I think it's about being quite disciplined as well with yourself. And instead of sort of sitting down and watching a television program thinking, I can get an hour's college work done here. So, and being a little bit more strict with yourself and keeping a tight timetable, really. And I think it's having that drive, knowing that you want to complete it and get good marks as well. That does help.
I think you touched on it a bit earlier as well when you said, you do have to be committed to it. It's not I don't want to say it's not easy, because it's not. That's the wrong terminology I want to use. There will be challenges because, as you've said, you've got so many other things going on. It's not like a full-time college course. You've got your work, you've got everything else, and on top of the diploma, there may be requirements for English and maths. And for your particular apprenticeship standard, you also had to complete the care standard, the care certificate standard. So there is so much work to do. So commitment is important. But what I think was also good, what you said, is sort of the support you gained from your fellow students on the course. So obviously, I'm sure they would have been helpful, providing support to each other. And obviously, the fact that all the different departments in the college can give you help in different ways, IT, the library services, etc. And also we've got, remember our practical room where we've got the telecare facilities, so you can actually do some of the practical skills in their practice as well. So that's great. So, and I know obviously you're just at the end now, aren't you, of your apprenticeship? You have got to the point where you would now have just finished what we call your endpoint assessment, haven't you? Can you tell us a little bit of what was involved in that endpoint assessment, please, Kelly?
Yes, so the endpoint assessment involved a professional clinical discussion with a clinician, and it was broad spectrum, really covering every aspect of the diploma, if you like. So we were quite unsure as to what we would be asked. So really, it shows if you've been listening or not, really, and taking in the information that you've learned, because she can ask you anything about the diploma, really. So it was about an hour's long interview.
And that's from someone outside of the college, is it, Kelly?
Yes, it's external to the college. It's not a tutor or someone you know. It's a professional body. So, and like I say, that was total broad spectrum. Any questions, really? So, regarding policies, standards, duty of care, everything really that the diploma involved. And then we were lucky enough to be able to attend college to sit our online endpoint assessment 60-question exam, which again, we weren't sure what would entail. It was just broad spectrum in relation to what we've learned within the diploma.
And what you do in your day-to-day job, really.
Yeah, and it covered all aspects.
So would you like to tell us how you got on, Kelly? Because you just actually got your results yesterday, so the timing of this is perfect.
Yes, I did. So I passed the diploma and I passed my 60-question online exam, and overall, including the professional clinical discussion, I gained a merit.
Which is excellent.
Thank you.
Done. I'm so proud of you. You worked very hard for that, and you deserve a pat on the back, really, for that, and for that balancing that home and work and study balance. You know, it is testament to your commitment and dedication.
Yeah, thank you.
So my last question to you, Kelly, is just would you recommend apprenticeships then to anybody else?
Absolutely. I think if you're in the healthcare sector and you obviously wanting to go forward with your career, and I think lead by example, really, you know, and I think other people will then see how much you've enjoyed it. And like myself, I'm an advocate now for apprenticeships. And
Have you got any future plans then, you know, for your future learning and development in your career?
absolutely, I'm definitely seriously considering doing the Access Foundation course, and hopefully into nursing. So
Fantastic. Oh, that's great, Kelly, and I'm sure you'll be very successful.
yeah,
Well, I just want to thank you so much for your time today. It's very valuable time because you are a key worker. You're on that front line during this obviously awful pandemic. So your time is precious. So thank you so much
thank you.
for that. It means a lot. Keep up the good work.
Thank you.